Welcome to Adapting Quiz, and thank you for deciding to join us this Wednesday as we continue with our series on antibiotics. These are pharmacologies that you need to know. As usual, it's going to be like a riddle where I give you the content and then you figure out what is the name of the medication. You just straightforward. Those are buzzwords the NCLEX is going to ask you, and you have to be able to see them in the question and then figure out. You want to stick around. There's about 25 antibiotics, close to 20 to 25 antibiotics you're supposed to know. But in this very short video, we're going to talk about all of them in the buzzword manner, ways to master them. So stick around. So the first thing is, like antibiotics are very important. And so the first information I give you is this medication. You can use it for MRSA, right? And C. diff, but it can cause ototoxicity and nephrotoxicity, right? You have to give it slowly as much as possible. If you give it too fast, you are in trouble. This is the only thing you need to know about this particular antibiotic. The second antibiotic I want you to know about is this one. You need to avoid it in kids and pregnant patients. So you can't use this medication in them. It causes tooth discoloration, and then it has photosensitivity effect. So you can't go under the sun, right? Or you got to wear sunscreen and other things. Also, when you take it, you should avoid milk product. What do you think? This is one of the medications. The next one, if you take it, it's also going to cause ototoxicity and nephrotoxicity, right? Like the first one. You got to check the peak and the trough as needed. And you also have to monitor creatinine level. What do you think? It looks like the first one, but you see there's different buzzwords I'm giving you. The last one is a risk. If you take it, your Achilles tendons may rupture sometimes. You should avoid antacids, and then you should avoid iron products. What do you think? Does any medication come to your mind? You've read it before. You've solved a question that came to your mind by reading these four questions. They are questions in a very small form. Does anything come to your mind? If not, these are the medication. I give you 6 options. You got to select which one belongs to that. So you have Levofloxacin, Vancomycin, Gentamicin, Doxycycline, Ciprofloxacin, and Penicillin. Is a way to master pharmacology review for antibiotic that is used for nursing exams, questions and answers, is by trying to figure out what group these medications are in. Therefore, the first one that we're going to talk about is what? Something that can be used to treat MRSA. It can also be used to treat C. diff, but it can affect your hearing, it can affect your kidney, and you have to give it slow. There's 2 medications that are over there that you should know. Vancomycin and Gentamicin, both can affect your kidney and affect your hearing. But it's only one that can be used for MRSA and C. diff, and you have to give it slow, and that is Vancomycin. So this one go here like that. You should avoid it in kids. Or if you're pregnant, that means it's ototoxicity. If you're a young female, you're taking it, you should wear barrier method. It can cause tooth discoloration and it can cause sunburn, right? Which medication do you think is that medication? This is doxycycline, right? This is doxycycline. This is this group, tetracycline group. This is one of them. This is what they do. They look like the tetracycline group, and this is doxycycline. The same medication can cause ototoxicity, nephrotoxicity, but you got to check peak and trough, and you got to monitor your kidney function. Why? Creatinine, because it causes kidney function, and you got to check peak and trough so that it doesn't affect your kidney. 2 medications that you need to do, vancomycin and gentamicin. These 2, you need to do that. Kidney function, check the peak and trough, and monitor creatinine. Easy way to know them. This is what your NCLEX will ask you. This is what we call prioritization. This is pharmacology review to help you understand answer questions relating to Nclexrn practice questions and answers you see. Well, your Achilles tendon is going to rupture. You should avoid antacid and iron. By elimination, penicillin does not do that. But look at these two medications, Ciprofloxacin and Levofloxacin. You see, they have the same last name, Floxacin. This is Fluoroquinolones. They do the same thing. You should avoid it because it causes Achilles tendon rupture, especially in kids. So Levofloxacin and Ciprofloxacin, both of them refer to number 4. And this is the way I want you to go about learning pharmacology. Antibiotic. If you have issues with the antibiotic, this video is designed to master all the antibiotic you need to know. In one slide, we learn about almost 5 antibiotics. What is the next one? Try to see if you can answer them. These antibiotics, when you take it, it can cause QT prolongation. Does it ring a bell? You should take it with food because it can cause GI upset. Does it ring a bell? Think about it. The next one is a penicillin family group. So it looks like penicillin. It can cause some common allergies, right? Rash and GI upset. Does it ring a bell? Can you name one antibiotic that do that? This, when you take it, you can get C. diff. It's not treating C. diff, but it can cause C. diff, and you can have a lot of watery diarrhea. And if you're the nurse, when you see watery diarrhea in the patient taking this antibiotic, you need to report it to the doctor. Prioritization 101. That's what the NCLEX is going to ask you all in your nursing exams. Now, the medication now can use to treat C. diff after number 7 has caused the C. diff. We find antibiotic that can use to treat C. diff. But when you're taking that medication, you should avoid alcohol. It causes metallic taste and it makes your urine dark. At least you've studied somewhere, some pharmacology. I try to make pharmacology easy, as friendly as much as possible. Don't run away from it. I have a bunch of videos on adapting class. If you knew this adapting class that you can watch, that will make you more confident when you see pharmacology question. It's like any fundamentals, right? So what do you think? These are the medication. Do you see clindamycin symptoms over there? Do you see metronidazole symptoms over there? You see azithromycin symptoms over there? Do you see amoxicillin symptoms over there? Do you see vancomycin symptoms over there? At least you should be able to get the amoxicillin, right? I told you it's a penicillin family. It causes common allergy and rash. Therefore, this one go here. Right? There's one that you have to know, right? That are macrolides. Macrolide causes QT prolongation, and therefore they have fainting spells and other things. It can cause GI upset. Macrolide is Azithromycin, Erythromycin. Those guys are macrolides, and they cause QT prolongation. These medications will cause C. diff. One of them is clindamycin. It's bad. So when you're taking clindamycin, you're likely to develop C. diff. This one can be used for C. diff, right? But you should avoid alcohol. It causes metallic taste and dark urine. I intentionally said this question so that you can know the content well in the simple form. That last question, number 8, is very important. We can use it to treat C. diff, but these medications cause what? Metallic taste and make your urine dark. And you should avoid alcohol. Vancomycin and metronidazole, this and this, can both use to treat C. diff. But there's only one that you should avoid: alcohol. It causes metallic taste and dark urine. And that is not vancomycin. Vancomycin causes hearing problem, kidney problem, flushing in your face, right? It can do that. So those are signs and symptoms associated with that. But what is the most important thing you need to know here is metronidazole. If you're taking it, avoid alcohol. It causes metallic taste. It can change your urine dark, and then you can use it for C. diff. Clostridium difficile. One slide, 5 antibiotic, content-based pharmacology review for your nursing exams. This is the way I want you to master it. How about this one? What do you think? Same information. It cross allergy with penicillin, right? It can also cause C. diff. You should not drink alcohol with it. This medication, you can use it for UTI. It will make your urine brown. It can cause lung issues and GI symptoms. And this one, it can cause crystallized, so kidney stone. Because of that, you should drink a lot of water and photosensitivity. This medication is an antibiotic. It can tint all your body fluid orange, right? Orange red. It can affect your liver, hepatotoxic, right? But you got to wear what? Condom, because it makes your birth control not to work. Can you put down an answer choice for any of this? Sometimes the best way to learn is not keep coming out with an answer without not giving the answers. If you remember these medication, these concepts, these buzzwords, and you're able to put down answers, that means you know the pharmacology well. This is the way I want you to remember. You know the signs and symptoms associated with the pharmacology. You should be able to come up with the pharmacology. This is what we have, right? Trimethoprim sulfonamide, right? This is the sulfonamide, right? These are all sulfur drugs, right? Sometimes we call it Bactrim, right? Trimethoprim sulfonamide, right? That's the most common antibiotic everybody knows about. It's a Bactrim. Which one is this? This one is a Ceftriaxone. Which one is Nitrofurantoin? Which one is Rifampin? And which one is Amoxicillin? Think about it, right? There is two medication that has cross-allergy reaction with penicillin. That's Amoxicillin and Ceftriaxone. But which one is more likely to cause C. diff is Ceftriaxone. It's a medication that is used for UTI. It makes your urine brown and lung issue. This is the most common medication. These can also be used for UTI. Bactrim, trimethoprim sulfonamide. But the one that can cause humoral issue and brown urine is nitrofurantoin. Rifampin can sometimes be used for UTI, but it does not cause brown urine. It changes your urine orange. That is the concept. This one, I wanted to give you all the UTI medication if the urine color becomes some important. Rifampin does not give you brown urine. These medications causes crystals. You have to drink a lot of water, 2 to 3 liters of water a day. It causes photosensitivity. That means it's a sulfur drug. This is your flu. This is a sulfur drug. If I put sulfur drug here, you pick this one. I did not put sulfur drug. I give you signs and symptoms of sulfur drug. Crystalloid formation causing kidney stone. Drink a lot of water to prevent kidney stone, and a photosensitivity because it's a sulfur drug. That is trimethoprim sulfonamide. And the last one, it turns your body fluid orange, right? Orange red. So if you wear contacts, you got to remove it. If you wear dentures, you got to remove it. You got to have pad under your pant if you're female. If you're crying, you cry or urine will turn orange, right? And it can affect your liver. It makes birth control ineffective, and therefore you got to wear a barrier. And it's a TB medication. This is Rifampin. You get the gist? I hope you're learning something. And this is pharmacology review for the nursing exams. And this is the easy way I can present antibiotic without a long lecture in a friendly way. This one is we don't call it antibiotic because it's a strong antifungal, right? It causes shake and bake infusion reaction. That means it makes you like you having infusion reaction. You have sepsis or allergy reaction. You become hypotensive, you get a rash. All of it is benign, but it's not a bad thing that you're supposed to know. Because of that, you cannot transfuse blood at the same time when you're giving it to the patient. This is one of the things. These medication, well, you should avoid SSRI. Otherwise, you get serotonin syndrome, and you should monitor their platelets. These antibiotic, it causes what? Fainting spells. That means QT prolongation. That should give you a clue that is a macrolide, right? So pick a macrolide. And this one causes peripheral neuropathy. It affects your liver. You have to give the patient vitamin B6. It's a TB medication, right? Does that come to your mind? If you're able to put 4 answers down without looking at the answers, trust me, you're golden, right? Amphotericin is the most common one. It's antifungal. It's not truly antibiotic. And this is what it causes shake and bake infusion reaction and affects your liver. Because of that, you should never give it to the patient at the same time as a blood transfusion. It looks like they're getting blood transfusion reaction. Fainting spells, QT prolongation is common with macrolide. And azithromycin, erythromycin, these are this group. If you watch this video multiple, like I tell you, antibiotic, you just ace everything. Isoniazid, everybody knows, it's a TB medication and it affects your liver. And what? It causes peripheral neuropathy. So this one is that. And which one causes serotonin syndrome? Because it affects serotonin receptors. It looks like vancomycin, but it's not. It's an oral form of vancomycin. That's linezolid. So any patient who is taking SSRI should avoid linezolid because it can cause serotonin syndrome. You know what inhibitor does, right? Peripheral neuropathy. There's no peripheral neuropathy. It causes optic neuritis. Optic neuritis, that's inhibitor. There's no optic neuritis in the questions given you. Therefore, you cannot pick that. In the next slide, guys. This is the last one. Try your luck. You can put down your answer. You should avoid milk. You should not take antacid. You should avoid the sun. That should give you a clue, right? No sun, no antacid, no milk. Which medications are like that? You should avoid it in pregnancy. If you give it to a kid who is less than 8 years old, they may have teeth damage, discoloration, and then bone issue. This one causes what? Tendon rupture. Achilles tendon is photosensitive, and then you should avoid dairy products. We saw some of them, but this is I'm giving you a different kind, but it's the same thing. Well, these medication, we don't use it anymore these days, but you got to know it can cause aplastic anemia and gray baby syndrome. And this one, you should avoid ondansetron and then magnesium, right? Keep your magnesium normal. Something should tell you, ondansetron, and I should keep my magnesium normal. Do you see the connection? Ondansetron, magnesium normal. Ondansetron, magnesium normal. Ondansetron will cause QT prolongation. That's why you got to keep your magnesium normal. Therefore, which antibiotic, when you're taking it, you should avoid ondansetron and you should keep your antibiotic magnesium normal. It's macrolide, and macrolide is this guy, right? Macrolide is that one. So this is a macrolide. Erythromycin is a macrolide. So this is one here. This one causes aplastic anemia and is chloramphenicol. The rest is history, right? You know there's a what? Fluoroquinolone there and tetracycline. There is tetracycline group and chloramphenicol and fluoroquinolone. You shouldn't mix them. They're very unique, right? The tetracyclines are always teratogenic, right? They're very teratogenic. You cannot give it when you're pregnant. It's a sulfur drug. You should not take milk with it. This is Nclexrn's favorite. It's a selected apply. Please know these tetracyclines. Doxycycline, tetracycline. You should avoid milk. You should avoid antacid. It causes photosensitivity. It has teratogenic effect. You shouldn't give it to kids who's younger. That's all, that one. And then fluoroquinolone, this is levofloxacin or ciprofloxacin, common with Achilles tendon rupture. Day 2, no iron product and no milk. That is the way to master them. 20 NCLEX questions on antibiotic. This is pharmacology in the very straightforward. A single video to master all the antibiotic you need for your nursing school and the NCLEX. Thank you for watching. If you hear my voice for the first time, this is Adapt NCLEX. If you like this video, subscribe for more content like that. Or you can join our crash course, which is coming up in July 12th to 22nd. You can email me or check my website. You can find it on YouTube to find more content like that. 10 days review crash course. Take care of yourself and have a good day.